When you come across a situation, or in your role as a first aider, and you're called to deal with someone who is unconscious, you'll need to call for help and try and find out from somebody who witnessed it what's happened. First, you need to stop, think and act. Look for hazards and make sure they're removed. Look for other potential dangers and things that may be in the way. Make sure there is someone with you if possible, so you can send them away to call the emergency services if needed. Introduce yourself to the patient and give them a little tap on the collarbone to see if there's any response and ask permission to help. If they are conscious, you can talk to them and find out what's happened and stop them from moving while you assess them and decide what action needs to be taken. If they're unconscious, make sure that they're breathing. If they're not, you'll need to commence CPR. To check for breathing, you'll need to open the airway by using the head tilt chin lift. You do this by tilting the head backwards. This draws the tongue away from the back of the throat and allows air to pass. Place one hand on the patient's forehead and the other under their chin. Have a quick look inside their mouth to see if there's any obstructions. Gently lift the chin and push the forehead back in a smooth, gentle action. Look, listen and feel for signs of normal breathing for up to 10 seconds, placing your ear close to the mouth and listen and feel for breathing, and look down their body for the chest rise and fall. If they're breathing normally, CPR is not required, and you know the situation and you can send someone to make the call for an ambulance, making sure that you tell them to come back and tell you when the ambulance will arrive. To make sure the patient's airway remains opened and to ensure they cannot choke on their own vomit, you'll need to place them into the recovery position. If available, put on your gloves and do a quick head-to-toe survey and check for any injuries. Gently feel their shoulders, arms and chest for any deformity, blood or fluid. Check that their legs are in normal position and there is no real damage to the hips or the legs. When the check is complete and you found no evidence of any injury, the patient should be placed in a recovery position as follows. Kneel next to the patient. Ensure the legs are straight and the feet are together. Take the hand nearest to you and place it on the floor at 90 degrees to their body. They will end up resting their head on this arm. Take the hand furthest away, interlock fingers and hold it against the cheek that's nearest to you. Do not let go. With your other hand, grab their knee furthest away from you, lifting the foot flat on the floor and using the leg as a lever and still supporting their head, pull their whole body across onto their side. Check the airway is open, tidy their legs so it supports them and they stay on their side. From this point, your role as a first aider is to keep the patient comfortable and warm. If you have one, use a foil blanket from your first aid kit or anything to cover them and keep them warm. Remember, speak to the patient and always monitor them to make sure they're still breathing and keep talking to them at all times. If there's someone available to help, ask them to find out when the ambulance will arrive. If you're completely alone with the patient and don't have a phone with you, this is where you'd need to leave the patient to go and call the emergency services, but make sure you check their breathing when you leave them and when you return.